Which client should the charge nurse assign to the new graduate nurse on the respiratory unit? So what are important words in this scenario? First, charge nurse. It is delegation from the charge nurse to the new graduate nurse. So the delegation is not from an RN to an LPN. It's not from an RN to the UAP. It's from the charge nurse to a new graduate nurse. Now, you have to understand that it is a nurse. Now, the question is, do you need to find a most stable patient or an unstable patient? You need to find the most stable patient. So you have to go answer by answer, 1, 2, 3, and 4, and identify if the patient or the client is stable or unstable. So answer number 1, the client diagnosed with lung cancer who has rust-colored sputum and chest pain of 10 on a scale 1 to 10. So what is the problem on answer number 1? The patient has severe pain, severe chest pain, because 10 on the scale of 1 to 10 is severe and unstable. And also has rust-colored sputum. So patient number 1 is unstable. So answer number 1, eliminated. Answer number 2, the client diagnosed with atelectasis who is having, this is an important verb, there is a problem now, is having shortness of breath and difficulty breathing, ABC compromise. So this patient is unstable. Remember that we are looking for a stable patient. Answer number 3, the client diagnosed with tuberculosis who has a non-productive cough and orange-colored urine. So answer number 3, you have to identify, is this patient stable or unstable? The patient is stable. Are these symptoms non-productive cough, orange-colored urine? Is that expected or unexpected? So stable, expected. That looks like a good answer. Let's see answer number 4. The client diagnosed with pneumonia who has a pulse oximeter reading of 91. Remember, an O2 saturation of 91 is indicative of hypoxia. So there is ABC compromise in answer number 4 and has a capillary refill time greater than 3 seconds, which is also abnormal. So answer number 4, the patient has an acute condition, ABC compromise, unstable, therefore I cannot assign this patient to the new graduate nurse. So answer number 4 is eliminated. Answer number 3 is the right answer. Why? It's the most stable patient out of 1, 2, and 4. Okay?